One thing we haven't touched on just yet is the impact of testosterone on bone density. So can you speak a little bit to that connection there between testosterone and the musculoskeletal system?
Yeah. If there are any physicians watching this, they have to get this. Testosterone is important for bone. It's like men get osteoporosis too. They get it a little bit later than women. Women get it mainly beginning around their bone loss around menopause. And so men are about a decade behind women. But men who have low levels of testosterone are at risk for osteoporosis, and they often have osteopenia. And one of the standard things that I started doing years ago when I did this work and started learning about the data was actually, we got a bone density machine. And we've published a couple of papers on it. And even in young men under the age of 50, the rate of osteoporosis, if I remember our data correctly, was 6%, which is a high rate. And there was a very substantial rate that had osteopenia. You know, our bone density only goes in one direction after a certain young age, and it goes downwards. And of course, the risk is that we get enough loss of bone that we're prone to fractures as we get older. So it's not yet in the general medical community as sort of conventional wisdom that one of the things to look at with low bone density is testosterone level, or that testosterone may help with it. But we now have multiple studies that have shown unequivocally that testosterone therapy in a man who's deficient with low bone density, that the bone density will improve. I just got a note from a friend of mine who I know forever, who I diagnosed with low testosterone quite a number of years ago. And we put him through the DEXA machine, and he had osteoporosis. Wow. Now, osteoporosis has no symptoms, right, unless you get a fracture. And, you know, he was probably about 50 at the time. And I just got a note from him, he lives elsewhere, that he had he's been on testosterone, he's had a follow-up DEXA, and he no longer has osteoporosis. His bone density is improved. He's still in the osteopenic range, but osteopenia is not associated with fractures. Osteoporosis is.